Hello, and thank you for contacting Wave Clinical Support. From your case, I see you have a patient who's post-RK and is struggling with some late-day filming and discomfort with their Wave contact lenses. And from a clinical observation, you've noticed some central pooling and some mid-peripheral bearing with the lenses. Well, let's take a look at your designs here for a moment. Well, first of all, a couple of general observations. As you know, with these RK patients, especially patients who've had a number of incisions made, as you know, this peripheral part of the cornea tends to be a little bit less stable, more malleable, and more prone to warping and distortion wearing a rigid lens. As you know, those refractions can also fluctuate a lot throughout the daytime due to the corneal warping. I also want to share a couple thoughts. Generally speaking, from fitting a number of patients through the years, that when patients complain of late-day discomfort in filming, more often than not, it goes back to some dryness issues, some tear film issues, maybe whether it be my Boehmian gland issue or lenses just getting too tight later in the day. It seems like quite often we get that my lenses are a real filmy feeling. It really is quite often a dryness issue. So with that said, if we go back to looking at our topographies here, as you know, Wave extrapolates out here in the peripheral cornea, so we don't always have a lot of true data out there, so we have to be mindful of how that peripheral relationship is. So if we look at your designs, I actually overall like the designs. I probably would have started exactly where you did with these. They actually look very nicely aligned with this cornea. But if we talk about how this lens is sitting on here, if we look at the topography and this back surface of the lens, if we look in through here, you'll notice that your optical zone is out here at about 6.5 or so, and that if you look at that lower design back here, that puts it kind of in the middle of the red zone. And if we look at the back surface of that lens, we could sort of see where, if you get out here in the central part, we probably have this lens will, even though it's pretty uniform curvature through here, you'll probably have some bearing or some clearance in through here, giving you some pooling. And then when you get out here in this mid-peripheral area, as this lens hits this zone right here, is probably where you're hitting that steeper part of the cornea, causing some bearing issues. With that said, if this cornea is as malleable as I think it is, having that many incisions, we're probably getting some distortion in this cornea out here that might translate into that post-operative or post-contact lens spectacle blur. And then if we don't have great relationship out here in the corner, we might even have some adherence. Notice you have a pretty small peripheral curve, so we probably have a minimal tear pump, and so my guess is this lens are probably getting rather dry later in the day. And if you even look at this design right in through here, you see it's pretty tight. So although this looks really nicely aligned, what I'd like to do is see if we can somehow get a little bit more tear exchange on that lens and maybe match this back surface a little more closely to this cornea. So the easiest way to do that, if you want to get a little flatter lens, a little looser, I'd probably go to tangential design. If we talk about that for a moment, if you remember axial designs, we're all taught to fit in that. Axial gives us a pretty true representation of the central cornea, and then it tends to be a little less precise out here in the peripheral cornea. Contrast to that, the tangential design tends to be a little bit more accurate in representing this peripheral cornea and less accurate in the central part. So what I would probably do, since this is probably the main area of concern, having where all those scars are from RK, I would probably lean a little bit more in the tangential design. So what I did here, I created a little quick design over here. Keeping in mind this, what I mentioned about the optical zone, I took this optical zone down to try to match that a little bit more closely to this optical zone of the cornea. And if you look at somewhere around, if you go in each meridian, this one here we're probably 4.5. This one's probably closer to 4 3/4. I mean, you probably got 4.5. I just set it arbitrarily at about 5 down there, which gets a little bit closer to that zone. And this, if you look at the other end of here, if you go over here to the other side of this zone, we're probably in that 8-ish range, so I brought that down to 8, so we got about 5 and 8. I switched this over to tangential design, and once the lens designed, I went through its design. You can see now we have a lens that's still very nicely aligned, but you'll notice we have a little bit more clearance here. I did go into the 50% meridian, this upper one, just bump up that, get a little more of a tear pump in this vertical, and then in 100% mode, I brought up this peripheral curve just a little bit to loosen it up. And if you look at this lens, if we just click over to RSIM, it'll kind of give you the general base curve of this lens. So you look in the axial design, we're set at 965, and if we do this one, we're 985. So you definitely get a little bit of a flatter fit to that lens. So I think that'll help out a little bit. If we look back at our design, I would anticipate this lens to fit a little bit more nicely, a little bit more better aligned in through here, get less of that adherence later in the day, probably a little bit better tear pump. My guess is this lens will give you less of that, what I call a cookie cutter feel of the lens irritating the eye. I would work on the design. Once you get the design, I would probably use it based on that first lens this patient is wearing, since that seems to be the one that you got a bit of a spherical over refraction on. I would probably incorporate that as a starting point and then go from there. And with that said, I would expect this lens to work reasonably well. Well, it sounds like you're pretty close on your designs, and I wish you well with this case. If you have any other questions, don't hesitate contacting us. Otherwise, thank you for contacting Wave Clinical Support, and have a great day.